All right, let's talk about spinal compression fractures, what they are, and, what comes next.
It can hit you out of nowhere, doing something you do every single day.
People often say exactly that. It's a totally different kind of pain, and you just know something's wrong. And if this sounds familiar, well, you're not alone. This happens hundreds of thousands of times a year in the US. So what's actually going on here? Basically, one of the building blocks of your spine has partially caved in.
And check out the shape change. A healthy one is like a block. The fractured one, it gets wedged.
So who gets these? Well, it's not random. There are some really clear risk factors at play.
And here's the real tell. A tiny event causes huge pain. That mismatches everything.
Getting the right diagnosis is a multi-step process. You've got to get the full picture.
That MRI is super important. It shows that the fracture is new, which changes the whole game plan.
Okay, so once you have a diagnosis, the goal is simple. Get you moving again without pain.
There are really two main paths forward. It's not one size fits all. It all depends on the fracture.
But what if the pain is just awful and the fracture isn't stable? Then what?
That's where something called kyphoplasty comes in. It's a way to stabilize the bone from the inside.
And the recovery? Wow, it can be incredibly fast. We're talking pain relief within hours.
But fixing the fracture is really just step one. Now you got to prevent the next one.
Because once you have one, you're way more likely to have another. It's called a fracture cascade.
So the key is a solid plan to boost your bone health and stop that cascade in its tracks.
So the big question becomes, what's next for your bone health? This could be a real turning point.